Okay, so I have already washed my hands and have donned gloves. I'm about to go into my patient's room. Knock, knock. Hi, my name's Carolyn Evans, and I'm going to be your nurse today. Who do I have the pleasure of speaking with?
Win Holcomb.
Okay. Can you tell me your name and date of birth?
My name is Win Holcomb, born January 19th, 1960.
Oh, okay. And would you be okay with us doing a health assessment since you came into the office today?
Yes, that'll be fine.
Okay, it is completely confidential.
Okay.
All right. Can you tell me what year it is?
2023.
Okay. And can you tell me who the president is?
Joe Biden.
Okay. And can you tell me where you're at right now?
I'm at home.
Okay. Clinic home. It's all good.
Yeah.
All right. So I'm going to ask you, okay, have you had any like sadness, any hopelessness lately?
No, not really.
Okay. And you haven't had any suicidal thoughts, right?
No, none.
Okay. What would you do if your house was burning?
I will run outside and call 911.
Oh, okay.
Yeah.
All right. So that sounds pretty logical to me. You don't sound like you're depressed. You're talking to me just fine. You look like you're very well kept. Take good care of yourself. Okay, so we got your vital signs before you came in here, and it was like blood pressure of 132/70. Checked your EKG. It showed a regular rate and rhythm. Your pulse rate was about 62. Respiration's about 15. Any pain on a scale of
No.
0 to 10?
No, no pain at all.
So 0?
0.
Oh, okay. All right, that's good. Okay, I'm going to give you 4 words, and I want you to remember them, okay? Cat, doll, candy, and sock.
Okay.
All right. So, under the circumstances, can you tell me what did you have for, well, when was your last vacation?
Last weekend.
Okay. Can you remember it pretty vividly? Any memory problems?
No. I remember it all pretty good.
Okay. And if a family member was here, I would ask them to verify whatever he was going to say. All right. Can you tell me those 4 words that I just mentioned?
Cat, doll, cake. Oh, I forgot.
Uh-oh. Okay.
Cat, doll, cake, candy, cake.
Well, cat,
Cake.
doll, candy, and sock.
Oh, candy and salt. Okay.
All right. So, might have a little lapse of memory there, just a tiny bit. All right. You seem to be in a good mood. You don't feel like you're down in the dumps, right?
Right.
Okay. All right. So looking at you in general, you're breathing normal, no accessory muscle use. Your head looks symmetrical, face symmetrical, normal cephalic. All right. I'm gonna examine your head right quick. I'm gonna see if you have any bumps, any bruising or anything. Okay. So you have a little bit of thinning up here, but so fine hair a little bit, and then coarser hair over here. I don't feel any bumps or bruising. All right, I'm gonna check your sinuses, okay? Okay, if you'll take off your glasses right quick, and I'll also check your eyes while I'm at it. All right, so I'm gonna pull down, and we'll check your eyes first. I'm gonna pull down your, you can open them for me, but that definitely tells me that your nerves are working properly. Okay. Pink conjunctiva on both sides. Eyelashes look to be in place. Eyebrows in place. Sclera is white. Okay, let me check your sinuses. Any tenderness?
No.
Any tenderness?
Nope.
Okay. Alrighty. So Do you tend to have like a more oily scalp? Have you noticed?
Maybe lately, yeah.
Okay, because it does look a bit more oily than your forehead. That could be, I mean, because you just got the thinning of the hair. Okay. All right, so we're going to check some of your nerves. So we've got your trigeminal and facial nerves that we're going to check. And I'm going to check to see with your eyes closed. Close them. Keep your eyes
Glasses on?
closed.
My glasses?
Yes,
These-
with them on.
Okay.
Okay? Tell me where I'm touching you.
Left cheek. Right cheek.
Okay, do they feel about the same?
Nose. Left temple. Right temple.
Okay.
Chin.
Okay, and everything feels about the same. No. Okay. Smile for me. Okay, no facial droop. Bare your teeth. Okay. All right, now we're gonna check your taste. I'm gonna give you something sweet.
Candy corn.
Does that taste normally sweet to you?
Tastes like candy, sweet.
Okay. And something salty. Where's your...
Gardetto crackers.
So your taste is intact.
Saucy.
That taste is salty. Okay, good. All right, now we're gonna check your olfactory nerve. Close your eyes. What do you smell?
Coffee.
Okay. What do you smell?
Cinnamon.
All right. Does it smell like it normally does?
Yep.
Okay. All right, so that was your olfactory. All right, usually, like back to your eyes, we're gonna go ahead and check those. I already checked to see how your conjunctiva and all that looks. So let's check your pupils. Can you take your glasses off again for me? All right. Okay. Eyes are, well, pupils are equal, round, reactive. And I want you to look at this and then look at that sign behind me. Okay? And accommodating. All right, now I want you to stand up. Put the glasses back on. Okay. I want you to cover one eye. All right. Now, on this sign, the Snellen chart that we have over here, what's the lowest that you can read on that eye?
PECFD.
Can you try a lower one? It's okay.
It's a little tough. Can't, yeah.
All right, swap eyes for me. Tell me again.
Okay. PECFD.
Okay, you want to try the lower one?
No, can't get it.
Okay, go ahead and take that down and look with both eyes and tell me what the lowest one is that you can read.
PECFD.
Want to try the lower one?
Looks like
Okay.
REL.
No. All right, so we've got 20/50 with glasses for your eyesight. I'll just sit that down right here. All right, and now with your glasses on, follow this light, well, follow this pen. Do not move your head, just move your eyes. Alrighty, that showed the optic nerve by using the Snellen chart, the oculomotor, trochlear, and abducens nerves by our 6 cardinal movements of the eyes. Usually I'd use an ophthalmoscope to check the optic disc and fundus, look for the red reflex on the optic disc and see if there's any issues with the fundus. We can see your nerve, we can see your vessels and see if there's any issues. Okay, so I'm gonna look at your ears. Just gonna feel right quick and see if we have any tenderness. Any?
No.
Okay, how about on this side?
No.
All right, so I'm gonna pull your ear up and back and check inside of it. Okay, see cerumen that you would like to see. And on this side, see some cerumen. Okay, looks good. Are you having any issues with your hearing?
No.
All right, I'm gonna whisper some words and I want you to tell me what I'm saying.
Green bean.
Okay. Red sock.
Red sock.
Okay. Your ears, the acoustic nerve is intact. We would use an otoscope normally, pulling the peanut up and back so that we can check and see your tympanic membrane inside. It should be pearly and translucent normally, unless you have an infection or something. Let's see. So next we're going to look at, oh yeah, I was going to check and see, try to open up, try to keep your mouth closed while I try to open it, okay? That's good. And open up your mouth. Okay. And that's back to your trigeminal nerve, just checking it in place. Raise up your eyebrows. Okay, and I've already had you smile and we didn't have any facial drooping, so that was good. All right, so now I'm gonna check your lymph nodes, okay? So I've got pre-auricular, posterior auricular, which is the front and behind the ears. I don't feel anything, so that's good. Feel normal. Occipital and jugulo-digastric. Occipital is gonna be behind here on both sides. And right beneath the jaw. Okay. We have superficial cervical, which is going to be along your muscles here. Nothing, no issues there. Submandibular, submental, which is going to be underneath here. Okay, those all feel okay.
Mm-hmm.
All right, and then we have posterior cervical and supraclavicular. So we've got right here and then right there. Don't feel any swollen lymph nodes, so that's good. All right, now I'm going to check and see how your trachea is. Extend your neck up, please. Okay, looks midline. All right, I'm gonna use one hand and I want you to take a drink of water for me, okay? I'm just gonna check your thyroid. Okay, good, good. Alrighty. Neck looks midline. Okay, I already talked about your chest and how you're not using any accessory muscles. Alright, so I want to check your spinal accessory nerve. Sit up for me. Okay, raise up your shoulders. Okay, that's good. All right, so that was your trapezius and sternomastoid muscles working, showing that your spinal accessory muscle is working. All right, stick out your tongue. Okay, it was midline. That's your hypoglossal, and you've been talking to me. You've asked me not to do the gag reflex test, so I'm gonna verbalize that to check your glossopharyngeal and vagus nerve, we would check to see if you have a gag reflex, but because you've asked me not to, I will not.
Okay.
All right, so now I'm going to check your back. We're gonna check and see if you have any, here, let's turn it the other way, sorry. Okay, so I'm gonna palpate and see if you have any tenderness anywhere. Any tenderness?
No.
Okay, percussion. feels normal. All right, I'm gonna check your kidneys. Any tenderness?
No.
Any tenderness?
No.
Okay, sounds good. All right, I'm gonna listen to your lungs. Okay, we're gonna check your sides. All right, now we're gonna move on to your front. Oh, let me check your spine first, okay? I'm gonna follow this down. Tell me if it feels tender or anything. Anything?
Nope.
Okay, stand up for me right quick. Okay, see nice curve in your back. Okay, you can sit back down. Oh, lean forward here so that she can.
Oh.
Yeah. All right. A little bit more. Yeah. Okay. So I want you to breathe for me. Okay. Again. All right. That looks good. All right. Now I'm going to check your front. Tell me if there's anything that's tender.
Nope.
No? Okay, you got some scars here. That one was from that triple bypass that you told me about, and that one's from your torn muscle.
Torn bicep.
And then you have a splinter somewhere. Oh yeah, we'll need to get that out. Just gonna check your temperature though. Back of my hand. Feeling your face too. Temperature feels fine. Skin looks normal for ethnicity. All right, now I'm gonna listen to your lung sounds. Oh, let me percuss first. Okay. Okay, lungs are clear to auscultation, all fields. No adventitious sounds. I'm going to listen to your heart now. Okay. All right, I hear S1, S2, which is normal love dub that we look for. The heart sounds like it's within normal limits. Okay, I'm gonna check your capillary refill. Less than 3 seconds. Less than 3 seconds, no clubbing. Less than 3 seconds, no clubbing. I'm gonna check your skin turgor. We're gonna do it on clavicle. Okay, it does tend to go back a little bit, so you might be a little bit dehydrated. Okay.
Good.
So give me just one moment. All right. I do believe that concludes our exam, but I do need to tell you about a breast exam that you can do it on yourself at home. Even though you're a male, we can all still do it, okay? So you're gonna lie down on either a bed or on your couch, and you can go in an up and down method with your opposite arm to the other breast and check to see if there's any lumps, anything abnormal. You want to make sure that your areola, which is your nipple, the area around your nipple, is a darker color. Make sure that there's no leakage, nothing abnormal, no lumps. And then you'll also want to check whenever you're sitting up with your arm up, you can check underneath your armpit as well, because sometimes things will start there. Anyway, thank you very much for letting me do my assessment on you, and I hope you have a good day.
Thank you.